So this new mask mandate issued by the CDC earlier this week comes as more than a third of adults across the country have been fully vaccinated. But that is not the case everywhere, especially in Newark, New Jersey, where vaccine disparity continues to be a problem. So here to break down the numbers for us is Dr. Shereef Elnahal, President and CEO of University Hospital. Dr. Elnahal, as always, good to see you.
Thank you so much for having me.
All right, let's break down these numbers because nearly 3 million people have been fully vaccinated in New Jersey. But the latest numbers from the state health department shows that Newark is really lagging behind, with only 24% of adults fully vaccinated, 40% with at least one dose, while 16% of adults have initiated a vaccine course but not completed it yet. So we're putting a lot of numbers up on the screen so people can digest all of this. What does it mean to have initiated vaccine course but not completed? Is that getting the first shot and then saying, I'm done, I'm not going to get the other one?
Absolutely. So what it means is that for the two-dose course vaccines like Pfizer and Moderna, you've only gotten one of those two doses. So you do have some immunity protection. In fact, in real-world studies, about 80% effective with just one of those two doses, but you haven't completed fully that two-dose regimen yet.
How problematic is that? Because we're seeing that across the country. A lot of people saying, you know what, you're giving me a J&J one-dose shot and I'm okay with that. I think I'm going to be fairly okay with a one-dose Moderna or Pfizer that is. There's some problems in that thinking, correct?
There are problems, and it's actually an interesting phenomenon because earlier in the pandemic, we had an almost 100% fidelity in getting that second dose. But as you get to younger populations, and as I've been saying, it's a little bit less on hesitancy and more on motivation. When folks go through that first dose and maybe have 2 days of side effects that they don't like, they're less motivated to get that second dose because perhaps they don't see COVID-19 as much of a risk to them if they're low risk overall. And so what I would say is the clinical trials do show that the most benefit comes from two doses. And as we see variants rise in India with the surge happening there, and as we just have that last mile left, folks should really just try to complete that course.
All right, before we get too far away from the numbers in Newark, which we just laid out, I want to ask you, is it a problem of access or supply? Why aren't the numbers higher?
It's squarely a problem of access at this point, Betty. So right now we have more than enough supply to meet demand in Newark and in New Jersey. And so we are getting more and more vaccine stock every week. More of this is around hesitancy. It's around motivation, as I just mentioned. We do have the shots. We do have the ability to get you an appointment now within days, maybe a week. That is a much different situation than we were just a few weeks ago. And so really, we have to be in the community with vaccine stock much more. And as an example, this Saturday, we're having a completely all walk-in clinic for anyone. Don't have to make an appointment at all. To allow folks to, on a weekend, come in if that's the right time for them.
Yeah, that's important because we're seeing in New York it being opened up so you don't need an appointment, which is creating more access for folks. Let me ask you about getting just this one shot, because you say it's a good deal for certain members of the population. Tell us why the J&J one shot is a better deal for certain members.
Well, you have a clinical trial, Betty, that shows that this one-shot regimen is near 100% at preventing hospitalization and death. And so with that level of evidence, it really does show that it's an effective and safe vaccine. We did have the pause to make sure that that extremely rare incident is not more common. We didn't get more reporting. And in fact, that advisory committee did confirm that. And so it is an effective vaccine. Overall effectiveness is a bit lower than the first two. But again, for things that matter, hospitalization and death, it is the right thing to do.
All right, I have to ask you about the new mask mandate because there's still a lot of confusion about this. I was at the playground yesterday with my children. I saw a lot of people with no mask on, but the mandate is if you're around other people who have been vaccinated. A lot of this is the honor system. I don't know if this person has been vaccinated or not, right? So what do you suggest? How do we go about these guidelines?
It is the honor system, and I understand what the CDC is trying to do. The evidence does show that it's okay to go outdoors as long as you're not in a large crowd without a mask, and your risk is essentially the same either way in getting COVID-19, which is extremely low. All of that said, it helps to be able to provide more and more things that people can do when they are vaccinated, as we are trying to sell the vaccine even more to a less motivated, potentially more hesitant population. So the more that the CDC does this, the more that vaccinators like us at University Hospital will be able to make that case successfully.
But what about folks just walking down the streets of New York? It's starting to get crowded yet again, right? But you know, you're supposed to be able to walk outside as long as you're around other people who haven't or have been vaccinated. So what is the rule there? How do we follow these guidelines but still stay safe? Because there's a lot of thinking that has to go into, okay, how crowded is it? It is outside. Are these people vaccinated?
Folks should use common sense. And so really, when you're outside and you're not near anybody in a park, Central Park, wherever it is, that's one thing. But if you're in a crowded street, or again, going to potentially a place where there's a lot of people in close quarters, whether outside or inside, you're going to be at risk. And so as you start to see more and more people take off their mask, whether they're vaccinated or not, you can't ever confirm that by looking at it. Really just increases the importance of getting the vaccine and protecting yourself, because it gives you that peace of mind either way. You don't have to be wondering if folks are vaccinated or not, whether they have that mask. And so really just yet another reason to get the shot.
But even though you're vaccinated, you still must wear your mask, right, if you're around folks who may not be vaccinated. So even though there's that peace of mind, you need that precaution. All right, Dr. Elnahal, thanks so much. We do appreciate you breaking it down for us as always. Good to see you.
My pleasure. Thank you.
And as a reminder, this weekend's Health and Wellness Festival will take place from 10 a.m. until 2 p.m. No appointment is necessary. So, folks, it's not, you know, a blanket statement. Like he said, the doctor there, you've got to really do some thinking.